Hey everybody, this is Matt Shu from Upright Health, and today I wanted to answer a question that we've been getting a lot of via email. So, Upright Health has a couple different hip-centric do-it-yourself programs. These are all programs that deal with the pelvis and the hips in some way. And we get questions about what the difference is between these programs. So I wanted to go through each of the programs and give you a quick summary of what each of the programs is for and how it may or may not be relevant for you. So the first program is really Healthy Hips 1 and 2, and I consider them kind of one program because they are part of the Healthy Hips series. So Healthy Hips 1 and 2 are really geared towards the beginner person who's just basically trying to develop a little bit of hip mobility and trying to develop some strength. So in the Healthy Hips 1 and 2 programs, we're looking at some basic stretches to just help mobilize some things, some basic activation exercises to make sure you can feel the right muscles working. And then in the Healthy Hips 2 part of it, we look at a little bit of self-massage and also some other little stretches to throw into your routine. And then we show you how to progress yourself gradually to be able to be a little more competent at strength exercises. So, in Healthy Hips 2, we're going to look at how you can build your ability to squat properly and look at your ability to lunge properly. So these are different exercises that have carryover into real world applications. Really, it's the 1 and 2 program together help people who are kind of stiff, they're kind of a little bit uneasy about doing activities of daily life. It's a lot of stuff that we use with our older clients, or some of them call themselves the upright oldies. So it kind of helps you just get the basic movement patterns down and then provides you with templates and progressions so that you know how to gradually build your strength over time. So we are not advocates of having you go run out and do high intensity workouts, especially not right from the get-go. We want you to be able to start with some easy motions, get the right muscles firing, and gradually build up the strength to do harder and harder and harder things using smart programming and progressively making things harder so that your body gets stronger and stronger in a safe way. So it's good, especially if you're somebody who's older and is looking to try to build that up. If you're somebody who works at a desk, I don't care what age you are, if you're working at a desk and you feel like you really need to build some more leg and hip strength, Healthy Hips 1 and 2 are really, really, really good ways to go because they just break it down, keep it simple and very manageable for you. And it's easy for you to kind of set a schedule around Healthy Hips 1 and 2 to help push yourself forward. Fix Anterior Pelvic Tilt is the second program I wanted to talk about. So if you're somebody who knows you have anterior pelvic tilt, meaning you have a really strong lower back lordosis, your pelvis is tilted so that it feels like your gut is hanging forward like this all the time. You have compression in your lower back. You just feel like you're stiff all the time in the lower back. The Fix Anterior Pelvic Tilt program is really honed in on that. So in that program, it's a lot of it's mostly a video-based program with a workbook to help you design your own program based on the principles that we lay out for you. So we talk about what often causes people to be stuck in anterior pelvic tilt. There's a couple different ways you can be stuck there. We talk about what you can do about that and how you approach it differently. We also give you a bunch of different exercises to pick and choose from that you will basically identify as being useful for you or not useful for you so that you don't spend 6 hours a day doing 100 different exercises. Instead, you're looking for the couple exercises that are geared specifically for your individual brand of anterior pelvic tilt. It's a very manageable program. It's very easy to work in as a warm-up or a cool-down for your other athletic endeavors. So it's very, very manageable, very easy, and very simple. So we've kind of laid it out for you to just kind of figure out how to get your anterior pelvic tilt into a more neutral position so you can go do the other stuff that you love doing. Can be useful for beginners, but most beginners probably don't have that awareness yet. So if you don't have that awareness, you don't know if you have anterior pelvic tilt, that's fine. Leave it for later. Probably you need to go to Healthy Hips 1 and 2. If you know you got anterior pelvic tilt and you've been trying to figure out what to do about it, that's the program for you. The other program is the FAI Fix, and also there's the FAI Fix for athletes that goes with it. I'm just going to refer to both of them as the FAI Fix. FAI Fix is typically for people who have been struggling with some really stubborn, annoying, nagging hip issue. Typically, these are people, our typical users have been to the doctor a number of times, have had x-rays, MRIs, and been told some very scary things. They've been to physical therapists, they've been to chiropractors, they've been to massage, and all these different things either provide only a limited amount of relief or just don't really seem to do much at all or make things worse. Due to a growing body of scientific literature, we are huge proponents of the idea that you should be dealing with the muscles in a very specific way to get the hip joint to function properly, rather than get focused in on the bone issues or the labral tears or the cysts in the hip joint. There's a huge body of evidence that is very strongly suggesting that those are not the cause of most people's hip issues. And so if you deal with the muscles first in the way that we lay out in the program, it's going to be much more effective and much more healthy for you long term. So the upshot to all this is that the FAI Fix is an extremely comprehensive, somewhat complex program that if you're not somebody dealing with all these different hip issues, it's probably going to feel really overwhelming. If you are somebody who has these hip issues, this is absolutely worth the time to look at, because this program goes through in a very principled way what to do, how to do it, when to make a decision of, do I change this? Do I move forward? Do I regress? Should I use this exercise or this exercise? What type of hip issue do I have? So how does that apply to this? We look at a lot of different questions in the FAI Fix so that you can understand how to make some decisions that oftentimes aren't even considered when you talk to most people in the conventional training or even in the conventional physical therapy or medical world. So we're looking at how to really adjust the coordination of your hip joint, right, to really get muscles to work in a balanced way all around the hip joint. And as you can imagine, that can be somewhat complex, as there are a lot of muscles that surround the hip joint, and they all wrap in very funny angles. So it can be quite challenging to understand all that. And that's why the FAI Fix is so comprehensive and goes so deep into so many different issues. We talk about tissue work, we talk about stretching, we talk about reactivation in a very principled, careful way, so that you understand how to do all that stuff in a way that builds your body up rather than exacerbates and makes worse your hip issues. But if you're not somebody who's been dealing with that issue, if no doctor has told you you have hip impingement or something like that, if your hip doesn't bother you that much but it just feels stiff, Healthy Hips 1 and 2 are probably a better choice. They're much more manageable for you. If you have had a bunch of issues in your hips, you feel pinching, you've been trying to get help with this stuff, and nobody seems to give you a comprehensive understanding of what to do, FAI Fix is definitely the way to go, especially popping, pinching, snapping, all that kind of stuff. The FAI Fix really gets into detail and depth about those things. If you're somebody who has anterior pelvic tilt and you just want to fix your anterior pelvic tilt, Fix Anterior Pelvic Tilt program is definitely the one that you should look at. Beginners just trying to build the strength, just go with strength and mobility. Then Healthy Hips 1 and 2 is definitely the way to go for that. So hopefully this summary helps you out, helps you make some decisions, and I hope you always remember that pain sucks. Life shouldn't.